everybody, welcome back. We are wrapping up week 22 and I've got a great show for you today actually, so we're going to go ahead and get started. One thing that I want to do, I want to update on Leo's homeopathic treatments. I talked to the homeopath just a couple of days ago. We got his clear pellets already, and the only thing that's really changed is she's actually increasing the potency of the emotional drops, which, judging by the last peek at the clear that we had, that I told you he was, you know, inconsolable that day, he's probably going to need it again because she's clearing pretty much the same vaccines that she had been. We had a brief discussion about rotavirus. She's clearing rotavirus this time, and I'll get into that in a minute. But here real quick, let me show you where we're at on Leo's timeline. So here's where we're at on Leo's timeline. She's clearing the 2 months vaccines and the 4 months vaccines, which are the DTaP, polio, Hib, hepatitis B, again, rotavirus vaccines. They're all right there. There's a list of them right there. So that's where we're at, and she's still clearing medications, like the Zantac for gas, because, you know, thanks doctors. So that's where we're at on his timeline. Now I'm going to put the link to his timeline in the description below because I think it's very important. So, you know, if you haven't checked out his timeline, please do, because his entire treatment is based on the information we provided. Okay, so as you can see, we're moving right along. Next month, she's going to be doing his newborn shots and clearing the vaccines out from when, you know, they poked him right out of the womb. And, you know, she said that we're probably going to be going, you know, she's given a little bit stronger emotional drops. She said we're probably going to be returning back to the weaker ones. So I think what she's doing is she's, you know, taking him up to this point, you know, flushing him completely out, and then we're going to, you know, gradually, you know, wean him off. So this is good. This is really, we're really excited. We did talk a little bit about the rotavirus because she made sure she wanted me to know what to expect as we're clearing that. And one thing that she said was that the rotavirus actually attacks the gut and creates, you know, digestion problems. And I thought this was interesting because Leo has gut problems, right? The whole point of even, you know, seeking out homeopathic treatment was because of his tummy. And so one thing that she told me was years ago, and I think it was like in late 90s, 98, 99, they came out with the rotavirus vaccine, and it was causing some problems, and it was actually causing the stomach to fold over on itself. Oh my God, okay? And allegedly they pulled it, you know, from the shelves, and they came out with a, you know, better vaccine, I guess, where it no longer is responsible for the many cases that cause that. However, you know, how reliable is that, right? So, you know, what rotavirus is, just so you understand, is that, and it's not really a big problem in the United States or in developed countries, but in developing countries and cultures that, you know, are a little behind us, rotavirus actually causes diarrhea, vomiting, you know, so the virus itself actually causes problems in the digestive area, and actually kids have died from chronic diarrhea. And I think this is that disease that, you know, that they're always worried about. So, well, let me just read it what I got in front of me here to kind of help out here. The rotavirus vaccine is a vaccine used to protect against rotavirus infections. These viruses are the leading cause of severe diarrhea among young children. Yeah, because, Kool-Aid and, excessive chocolate has nothing to do with it. Whatever. Anyway, the vaccines prevent 15 to 34% of severe diarrhea in developing world, and 37 to 96% of severe diarrhea in the developed world. Okay, so it's still a threat in, cultures that drink funky water. Go figure, right? Okay. Anyway, let's see. It says the vaccines are safe. Let's see. An earlier vaccine that is no longer used was linked to I can't pronounce that word. It's a long word, and that's actually where the gut flips over. In fact, let me just have a look at that. A medical condition in which a part of the intestine folds into the section next to it. Typically involves a small bowel and less commonly the large bowel. Symptoms include abdominal pain, which may come and go, vomiting, abdominal bloating, bloody stool. Okay, so some of the side effects of the rotavirus vaccine are actually those things. Yeah, go figure on that one, right? All right, so what we're going to expect from having the rotavirus being cleared is, he's going to have some tummy problems. So we have Pryor's patches, which is the drops she sent for gut problems, and there's actually a couple of them that are for, tummy aches. And so we'll probably be increasing those a little bit if we, see any kind of signs. He could have diarrhea. Yay for potty training. So we're going to be seeing those things. And she, sent more probiotics. We're doing great with the potty training. We're not pushing it. We kind of backed off a little bit, actually, because it was more frustrating for us. But, it's a good thing for him. He's, not turned off of it. He's not turned off of the idea, but we're just, success is not happening. But it doesn't matter. My bathroom looks like a, toy store blew up in it, and that's okay. Whatever. Anything to make it go. I got some great tips from our friend Jackie. There's some great tips online. In fact, our featured website, gave me some great tips. So, there's, resources available. I'm still learning, and we're still progressing one way or the other. So, potty training is doing great. Okay, so we're going to get right into it. I have a video I want to show you about Big Pharma. And the reason I want to show you this is because I was just going to take notes of what I've, the information that's provided. And I thought, I'll just show you the video. It's not very long, and it goes into detail of why we're in the position that we're in with the pharmaceutical companies and why healthcare is such a disaster right now. And it has nothing to do with, who's putting it in place, whether it be Democratic or Republicans. It has everything to do with who butters the hands of those Democrats and Republicans. It has everything to do with, gangster cronies who are rich and want to stay rich. And so I want to play this video for you just so that you understand why, even if you don't, seek out homeopathic treatment, why alternative medicine should at least be an option for you, no matter what. If you got a cold, if you got back pain, if you're struggling with Crohn's disease, autism, anything, ADHD. I mean, whatever you need to go to a doctor for, it's in your best interest to look to alternative medicine. And here's why. Enjoy. I'll be right back.
On our last show, we asked what you wanted us to profile on Swamp Watch, and a huge number of you said healthcare and pharmaceuticals. Whether it's the problems caused by Obamacare or the issues the Republicans have had trying to replace it, the real reason we're in this mess on healthcare is because it costs too much. And the reason for that is because both parties are in the pockets of big businesses that make money by pushing up costs. It's the health swamp. The pharmaceutical companies, the hospitals and clinics, and the insurance companies. So we wanted to spend the next few weeks showing you what's really going on with our country's healthcare system. Tonight we'll start with the pharmaceutical companies.
They're getting away with murder. And Pharma has a lot of lobbies, a lot of lobbyists, and a lot of power.
That was then candidate Donald Trump on the pharmaceutical industry's enormous influence and the swamp it's created at the expense of your health. 70% of Americans take prescription drugs, more than any other country. And it costs us more too. This chart shows that Americans pay over $1,000 a year on pharmaceuticals, way more than every other OECD country. Denmark citizens, for example, spend $240 a year on medications, and many of those drugs are developed and produced right here in the US. But all the money we spend doesn't lead to better health. In fact, our health is worse. We're 26th in the world for life expectancy, tied with Chile. But who could possibly benefit from us spending more on drugs but not getting any healthier as a result? The pharmaceutical companies, whose main incentive is to sell as many drugs as possible, and they have a whole medicine cabinet of swampy ways to do it. We talk a lot about revolving doors in Swamp Watch, and the pharmaceutical industry is no different. The Food and Drug Administration is the regulatory agency that decides which drugs make it to market. Researchers charted the careers of people reviewing certain medications at the FDA. They found that 60% of those reviewers who left the FDA went on to work for the biopharmaceutical industry. According to the lead researcher, if you know in the back of your mind that your career goal may be to someday work on the other side of the table, I wonder whether that changes the way you regulate. Yeah, I wonder. But perhaps the most blatant example of the health swamp revolving door is former Louisiana Congressman Billy Townsend. From 2001 to 2004, he chaired the House Energy and Commerce Committee, which oversees the FDA. During that time, drug companies and health insurance companies contributed nearly $1 million to his campaigns. Townsend was instrumental in pushing the Medicare Modernization Act of 2003 through the House. By doing so, he ensured that Medicare cannot negotiate with drug manufacturers for lower prices. He also made sure that drugs manufactured here and exported to Canada can't be imported back into the US, just in case they drive prices down and actually help American consumers. And then, after years of pushing big pharma-friendly legislation, what did Billy Townsend do next? He left Congress to run the industry's powerful trade group, the Pharmaceutical Research and Manufacturers of America, or Pharma, a job for which he was paid $2 million a year. This is the reality of the swamp. We all pay more, while an elite few get rich. Of course, it's just as bad on the Democrat side of the aisle. Senator Max Baucus was the man in charge of the Obamacare legislation. But guess who's being described as, quote, more personally responsible than anyone for the drafting of what became Obamacare? Someone you really should know about. Elizabeth Fowler. She was vice president for public policy at WellPoint, then America's second largest private insurance company. Who better to become Max Baucus' chief health counsel? How convenient for the health swamp to have one of their own people writing the Obamacare legislation for them. And how convenient for Elizabeth Fowler that after Obamacare passed, she landed a job as head of global health policy at Johnson & Johnson, one of the chief beneficiaries of President Obama's signature legislation. These big pharma companies have deep pockets. In 2016, the industry spent a massive $246 million lobbying. But the abuse of power doesn't stop there. Big Pharma has even corrupted clinical trials. Clinical trials are supposed to be an objective scientific way of showing that new medicines are safe and effective, except they're not objective. It turns out many are ghost-written by the pharmaceutical industry. They carry out their own tests on their own drugs and then publish them under the names of top researchers in medical journals, researchers who had nothing to do with the trials. A study by Transparency International said this is done to, quote, increase the prestige and reputation of the findings, while simultaneously researchers are able to improve their reputation, which can lead to promotions. These shady clinical trials are a complete fraud. One industry-funded trial claimed that a particular antidepressant produced 94% positive results. A later test by the FDA found only 51% positive results. Drug companies have also started paying doctors to participate in surveys of medicines that they never even prescribed. In fact, they spent $42 billion a year just on targeting doctors. Remember that when you see your doctor. On average, they are paid $61,000 a year by the pharmaceutical industry to push particular drugs, whether they work or not, whether you need them or not. The swamp extends to the official guidelines for prescribing drugs too. Statins are the drugs used to treat high cholesterol. 8 out of 9 doctors who wrote the recent national cholesterol guidelines received money from statin manufacturers. The psychiatrist responsible for overdiagnosing children with ADHD received $1.6 million from the manufacturers of the drugs used to treat it. The whole thing stinks. But perhaps none of this swampy behavior is as disgraceful as the pharmaceutical industry's role in the opioid epidemic, which killed 52,000 Americans last year. A health crisis so bad it's actually started driving US life expectancy down. For most of the last century, the terrible addiction that opioids can cause meant that they were shunned as a treatment for pain. But that all changed in the 1990s, with a large-scale lobbying and public relations effort to make opioids acceptable. Part of it was run by a non-profit, the American Pain Foundation. Sounds nice, right? A non-profit focused on reducing pain. Except that the organization was basically a front for Big Pharma. It received 90% of its funding from medical companies. Some of their board members have extensive financial ties to drug makers, and the group lobbies against limits on opioid use. The most commercially successful of the new opioids is OxyContin. It was released in 1996 by Purdue Pharma with a promise that the drug could be prescribed with less risk of abuse and addiction. Well, that turned out to be a lie. In 2007, Purdue Pharma paid $600 million in fines, and 3 executives pled guilty to felony misbranding over OxyContin. But don't feel too sorry for them. Purdue Pharma is owned by the Sackler family. In 2015, with the opioid epidemic that they helped cause raging through our country, guess where they suddenly popped up? Number 16 on Forbes magazine's list of richest American families. I hope they enjoy their $14 billion fortune. The health swamp is like no other. It is literally killing people while enriching those who play the game.
Okay, so, alright, check this out. You know that it's not just those people he mentioned, right? It goes like way deeper than just those people. Those are the tip of the iceberg. He mentioned, 3 different people by name. The family that, is the cause of the opioid crisis, and then, of course, the congressman and the other lady, Those people represent a great deal of people. And, you can't help but, you're watching TV and you get to see these commercials. Ask your doctor about Chantix. Side effects include, okay, Chantix is for not smoking, right? You take it to curb your addiction. You curb the habit. Okay, I'm going to tell you right now, as a smoker, the side effects to that drug are exactly what you would experience if you just quit cold turkey. Okay. So why do they want to push this drug? Money. Okay. And that's just an example. I just used Chantix as an example because that's the one that popped in my mind. But look at all these other commercials. Ask your doctor about Cialis. And then, the next commercial is if you or a loved one had suffered, injury or death, you may be entitled to a settlement because of Cialis. So let me tell you, it's a scam, and they don't have your best interest at heart. They have the best interest of their wallet. The rich want to stay richer, and they want to keep you sick because if you are cured, they lose a client, right? You're not spending any more money. So, it's just something to think about. It's something that, people just need to be aware. Be aware that there are other options. Okay, so having said all that, let's go into the featured website, the GoFundMe, and the products and services, and I will be right back. Okay, so this week I chose Mummy But Still Me website. It's actually a blog, and it has an amazing amount of articles, and she is such a great writer. I just urge you to check this one out, and the link is in the description below. As she's a mom, and she gives, you know, her perspective on all the mommy things. She's, you know, got this great category. She's got blogs, articles on children, Christmas, cooking, crafts, diet. You know, I checked out potty training recently because, you know, we're going through potty training with Leo. So, you know, any and all tips would be helpful. And I read how I potty trained my 2-year-old, and then helpful potty training advice. You know, so this is a great resource center for, you know, just to relate to another mom. So, yeah, I urge you to check this out. She's a great writer. Very informative, very clear, very genuine. Her link is on our blog and in the description below. So, yeah, please check her out. She's wonderful. Okay, so this week's GoFundMe, I chose Nikki's cancer treatment. Now, I haven't featured this one before, but she's been on our blog for a long time, actually. Oh, I wouldn't say a long time, but a couple of weeks. And so I just want to show you this GoFundMe. The story is pretty short here. She's 8 years old. She's been battling sarcoma cancer for over a year. It says she loves art, dancing, learning new things, making new friends. She's trying to stay positive. There was an update a few days ago that the chemo isn't working. But here on the website, there's 5 updates. It says chemo is not helping. Doctors keep trying new stuff. Please pray for Nikki. And, you know, so this is like one of the most saddest things I've ever seen in my life. We're just going to play this little video here and, you know, let you see for yourself. She is so sweet. Okay, so if you can't donate, you know the drill. Tweet it out, share it on your Facebook, share it everywhere. Really get the word out to help this little girl. She's been fighting for a long time, and cancer's, you know, no fun. So they got a goal of 19,000. They're up to 10. So I mean, okay, that is fantastic. Let's, you know, please get the word out, share it. If you can donate, fantastic, you know. So please pray for her. This is a horrible thing that no kid should have to go through. Thanks, guys. Okay, so this week our products and services is one I've featured before. It's called Happy Hands Toys, and they specialize in fashionable and functional toys for, you know, special needs kids. So I just want to show you here. They of course got fidget spinners. They got some LED flashing ball sensory. Oh, that's awesome. Leo would love that. They got, let's see, stress balls. You know, so they got a nice assortment of different toys for, you know, special needs kids. So let's have a look here. There's an About Us page, and it talks about their son with autism. So again, if you're shopping at this store, you're supporting another kid with autism. So remember, on birthdays and Christmas, don't make Walmart richer. Just come to Happy Hands Toys, or any one of the other areas that we mentioned on the blog where you're actually supporting other people. I do want to show you, let's see if I can find it on here. Puzzles and toys, wearables. It might be in wearables. I want to show you what I have. These are bracelets, very cute. Okay, so they have chewable necklaces, okay? And they are for sensory processing disorder. Kids, like Leo, have to chew on everything. So they got different ones for different needs. Like some kids are really aggressive chewers and some kids are not so aggressive. So let me just show you real quick. This is the one that I have, and I'll show you that in a minute. And when I first got it, I actually gave it to Leo in the bathtub because that's where he does most of his chewing. I mean, he will chew on anything plastic, anything paper, so I got to make sure there's no paper around. He'll chew on his clothes, he'll chew, but in the bathtub he's an aggressive chewer. And so they sent me a red one, and they got different colors. Look at that, so cute. Oh, that one's cool. So, these are great. These are absolutely great. Let me show you Leo's. Okay, so I took the string off because he wouldn't let me put it on him. But, check it out. It's real smooth on one side. It's got the bumpy on the other. And it's a real durable plastic. It really, there's just no chance that he's gonna, chew it up. So, this was made for children like Leo. I think this is great. And it's a great gift idea, too. I mean, this website is just packed full of gift ideas, for children with autism. So I urge you to check it out. It's Happy Hands Toys, and their link is in the description below and also on our blog. So yeah, support this family and, have a gander. Okay, well, that's pretty much all I have. Let me look at my notes because, I'm old. And you have to excuse the way I look. It's like 15,000 degrees outside. And I took Leo on a tractor ride. I got smacked in the face by a bug. So it's like, okay, to do this video, Daddy had to take him swimming. And, I mean, can you see my house behind me? We're planning a great big party for Leo in a couple of weeks. And so we're like brainstorming on this party. And it's just overwhelming. So, okay, so let's see. Yep, I think I covered everything I wanted to cover. So there it is. Here's a short video of a day in the life of Leo to take us out. Hope you enjoyed this video. Please leave your comments below. Subscribe, share it. Follow us on Twitter. All the links for everything is in the description below. And I will see you all next week. Have a wonderful, wonderful week. See you guys. Thanks for tuning in. He's watching cartoons. Yep. He likes this song too. Maybe we can catch him singing. Sing it. I love you. Skidamarinky-dinky-dink, skidamarinky-doo. I love you. Early in the morning, in the afternoon. Love you in the evening, underneath the moon. Skidamarinky-dink-a-dink, skidamarinky-doo. This is the song I sing when I wash his hair. That's the way I can wash his hair. Skidamarinky-dink-a-dink, skidamarinky-doo. I love you. Skidamarinky-dink-a-dink, skidamarinky-doo. I love
you in the morning and in the afternoon. I love you in the evening and underneath the moon. Oh, skidamarinka-dinka-dink, skidamarinka-doo. I love you.
You're so cute. Yeah, camera's on you. Ham. Some chairs upside down because he likes to spin the wheels. Can you say Mom?
Bob.
Very good. Can you say Papa? No. You can't have the camera. Can you say Papa? You boogerhead. You're a boogerhead. Okay.